No, no.
No?
Mhm.
Okay. So I'm going to review the gross motor section from 12 months to 36 months. So question number 7 asks if the child walks 3 or more steps with assistance. So it could be holding 2 hands if the baby takes 2, 3 steps. Then it says number 28, ask if the child walks 8 feet with one hand held. So just holding one hand, always try to hold the hand um, low, right, at a waist level or chest level, not pulling arm up, and see if the baby can walk 8 feet. You can try with one hand and try with the other one. Sometimes they have a preference. They do it better with one hand. We at 29, if they're using a push toy, they can take a few steps using a push toy. If the child is already walking independently, I usually skip that question. And but we ask the parents if they walk at home using a push toy or pushing a little chair and how many steps they're taking. Um, and then number 30, if the child is walking at least 5 steps independently. So if it's the child is walking from mom to dad, like 5 steps without falling, and if they are doing it consistently, right? Now that happened just one time. That would be when we give the questionnaire 1. Then 31, if the child demonstrate control start and stops when they're walking, so they walk and they can stop without using a wall to stop or a piece of furniture. So if they can take a few steps, stop, start again, walking, stop, walk again, stop. Okay. So number 31, if they can squat during play, sometimes we see the kids, they play in a squatted position. So we ask that question without falling to sitting. And the next question, if they can walk, squat down to pick up a toy or something, go back up and continue walking without falling. That is number 32. And creeping back, sorry, that was 33. 34 is if they creep backwards from furniture or from the bed. Usually we like to see that they turn on their bellies and they go back and they do it safely and slowly, going backwards and climbing on furniture. That's the next question. If they can climb on a low couch or play equipment at the park or the bed, if they can climb on their own. And see at the office, so we can ask a question to the parents. 36 is running or hurry walk. If they walk fast in preparation for running, or they run at least 10 feet without losing balance. We usually observe that or ask the question to the parent. Then we ask if they go up and down stairs. It has to be on their feet, holding onto the railing. Of course, we always suggest with very close supervision from parents, but we ask if they can do it independently. And sometimes they go up walking, but they come down kind of creeping backwards on the steps. So that one would be a 0. But if they go up and down walking, holding onto the railing or the wall, that would be a 1 for that question. And we can ask their skip a few questions and go to number 40 if when they go up and down, when they go up, if they alternate feet, right? 1 foot on each step when they go up. That will be for number 40. We can do it on the same question. Throwing a ball overhand with accuracy. See if they can throw a ball to mom or to evaluator using an overhand toss. Okay. And then when taking steps backwards, that's 39. We can see if somebody's chasing the child or they get ready to kick a ball or in a functional way opening that door, how many steps they can take walking backwards without falling. That is number 39. And if they can do like around 10 feet, we can give that question a 1. So that would be the section from 12 months to 36 months. Thank you.